everyone, this is Dr. Brayer with Creating Smiles Dental, and I wanted to tell you about my own ortho story so that you understand why I'm so excited about Invisalign. So back when I was about 12 years old, I got the traditional metal brackets and the braces with the wire and everything, and wore it for about 2 years. And during that time I had a lot of difficulty, not only with eating but certainly with brushing and flossing, and just had problems with food getting stuck in between my teeth. My gums were always bleeding because I could never seem to brush it all out, and flossing was nearly impossible. But I made it through those 2 years, and after that I got a retainer, which was the metal retainer that you could take on and off, and that was no fun to wear either because it was hard to talk with it. And then I actually broke the lower retainer. I broke the piece of the resin off of it. Didn't really like wearing it, so then I literally just stopped wearing it basically. And so, back then the orthodontist said if you wore it for a couple of years, then your teeth should be stabilized in that position and nothing would move. Well, now we know that that's not correct. It's because now several decades later, my teeth have all shifted, and my bite has been off. And more recently, prior to doing Invisalign, I was starting to get a lot of TMJ problems. And so when I saw an oral surgeon about my TMJ, because I was starting to have a lot of issues, with my jaw and just having limited opening and just a lot of pain and everything with it, I saw the oral surgeon and I asked him if he thought it would be a good idea to also consider straightening my teeth and getting them back into proper alignment. And he told me that it was a really good idea. So I decided at that point that I would do the Invisalign, because I'd certainly been talking to, patients and telling them and encouraging them to do it. And so I figured it was time for me to do it also. So I did it several years ago, and I'd have to say it was one of the best things I've ever done for myself. And so I wore the Invisalign for a couple of months. It straightened my teeth, and it was really not a whole lot of movement because the relapse that I had from when I was a child was not too bad, but it was enough that it really messed up the alignment of my jaw. And after I wore it and I got my teeth into the ideal alignment again, now not only are my teeth straighter and it's easier for me to clean them, but most importantly for me, now my jaw has completely stopped hurting. I have no more problems with the TMJ. I haven't had to wear a night guard since then. Since prior to that, I used to wear a night guard for decades actually, because I had a lot of stress and everything, and there was a lot of punching and grinding. Now I only wear my Vivera retainers at night, and that it does the job. And so I'm extremely happy with the results of the Invisalign, and that's why I would highly recommend for any patients to consider doing it, even if it's not for aesthetics. I certainly didn't do it for aesthetics myself because it was already fairly straight. At least when you looked at it, it looked pretty good. But in terms of the alignment, it made the biggest difference for me. And I'm just going to show you really quick my case here so you can just see. This is me before Invisalign. You can see the teeth look pretty straight. Okay, but I'm going to show you now as I'm slowly moving it here. This is after Invisalign, and you can see the difference doesn't look that much when you're looking at my face wise, but when you look at the actual arches, this is the upper arch, and you can see I'm going to shift it straight, and you can see the movements are slight, but enough that it made a huge difference. This is me pushing it back to the beginning, and I'm going to go all the way to the changing it to make it straight again. But it made a very big difference in terms of my alignment of the jaw. So now this is the lower arch. You can see before, and this is after. You can see the difference here. I just slightly shifted the arch a little bit, but again, just enough that everything now is ideally where it should be positioned. And you can see the bite and everything. It looks really, really good where it should be. And I'm so pleased that I finally did Invisalign for myself, and I would highly recommend it for anybody who feels like they're having any problems with their teeth and everything, with the alignment of their teeth. Thank you.